Hi guys, I'm Beck Irving and I'm a myotherapist, blogger and online mentor, and I just want to say big warm welcome. Thank you so much for joining me and wanting to find out more about what myotherapy is. So myotherapy in a nutshell is the assessment, treatment and rehabilitation of musculoskeletal pain. And to talk a little bit more about this, I'll sort of run through what my treatment sessions involve to give you a clearer understanding. So first up is the assessment process. This can range for a number of, every therapist has a different way of doing this. I like to do it starting from the get-go before you make the booking, so we can get a clear idea a little bit about your pain and how we might be able to change it, if you may need a referral, or if we won't be a great fit to work, let's be honest, a great fit to work together. Sometimes we may not vibe, and that's completely okay. And I can go, hey, I don't know if I'm the right therapist for you. Why don't you see this person or this person? And we can counteract that from the get-go instead of you spending an hour of your time with me and not getting anything from the session or any value or takeaways. So I like to combat that from the get-go. When you come for your first appointment, we sit down and we have an in-depth chat on exactly where you're at right at this moment, your pain, and things that we can do to help counteract that pain and what we can do to change it. The goal is that you can manage it outside the clinic space and that you won't need to be seeing me once every 6 weeks. We're getting those tools and strategies in place so you can manage it yourself outside the clinic space. That is the important thing, and that is why it's so important we sit down and chat and spend a good chunk of that time getting to know you, understand your pain, and the other influences that may also be contributing. Following the assessment, we have the treatment session. This is everyone's favourite because they get the hands-on treatment. So it may involve massage. Yay! As there's a lot of confusion that massage and myotherapy are the same thing. They're not. Massage is simply a tool that myotherapists use. Yes, a lot of us have trained as remedial therapists or worked as remedial therapists before we became myotherapists. So we use that tool a lot. It's also that consideration that your treatments may be over half an hour long, so it might seem you're getting a lot of massage. And it is a tool I do use a lot for my clients. Another tool you may use is dry needling, not to be confused with acupuncture. So dry needling is based on Western principles where we're dry needling the muscle, whereas acupuncture is based on the Eastern Chinese medicine principalizations, which is a technique that takes that joint through that range of motion within your limitation, of course. So some people think like you get that big crack. Not the case. We're just gentle movements through that range of motion and within your limitations. So you're not getting off the table like, oh, like that was insane, like that was a tough treatment. Moving on into the rehabilitation side, I love this side because rehabilitation means so many different things to so many different people, but I like to think of it as the strengthening and conditioning. So you wouldn't send an athlete out onto the field to sit in one position for 8 hours, and if you did, he would have a bit of preconditioning and lots of training. So sitting for long periods of the day in front of the computer for 8 or so more hours is an unnatural body position for us, and our bodies just aren't conditioned to handle that. So a lot of people have stretches that they do, and yes, they may help, but they don't ultimately change that pain. So that's why we look at incorporating strength and conditioning tools. We look at some self-care tools because you are your greatest asset in all areas of your life, and if you're not able to function at your best, the rest of your life just doesn't tend to either. So we look at incorporating some self-care tools, and we look at the follow-up on that. that you're able to incorporate that into your daily life, that it is practical, that it isn't overwhelming, that you're not given 20 exercises and expected to do them all. Really, it's really about what's working for you and how we can work that into your everyday life. And I like to spend a good chunk at the end of the session talking about your self-care, because that is so important. And when you nail your self-care, the exercises, the rehabilitation side of it, it just happens. Another reason that it's so important at this stage is that ultimately you only see me an hour once every few weeks in the ideal situation. I don't want to be seeing you all the time, because I want to empower you with the knowledge and the tools that you can manage your own pain so that it's no longer a factor. I hope that breaks down what a myotherapy session entails. I'm Beck Irving and I'm based in Geelong, Victoria. I am opening up the books to take on more myotherapy clients. So please do reach out if you feel this might benefit you or someone you might know. My best mode of contact at the moment is via that Facebook inbox up there. And send me a message, even if you just got a quick question or something resonated with you and you think, actually, you know what, I want to find out more about that and how myotherapy can help me. So I hope that explained a little bit more about what I do, what myotherapy is, and how I might just be able to help you a little bit. Thanks so much for tuning in. I'm Beck Irving and I'll see you all soon.